Okay, hello. Let me share my screen. Okay. So my presentation was on Clostridium difficile, or C. diff for short. Let me do present. Okay. And my name is Susie Caparelli. Okay. Some symptoms of C. diff for a mild to moderate infection are watery diarrhea for 3 or more times a day for 2 or more days, mild abdominal cramping and tenderness, and signs and symptoms usually start showing within 5 to 10 days after starting antibiotics, but then if they can also occur 1 day after starting antibiotics or 2 months after starting antibiotics. Some symptoms of a severe infection include watery diarrhea 10 to 15 times a day, severe abdominal cramping and pain, rapid heart rate, fever, blood or pus and stool, nausea, dehydration, loss of appetite, weight loss, swollen abdomen, kidney failure, increased white blood cell count, and in rare cases, death. Ways to diagnose the disease. So doctors can order the following stool lab tests for C. diff. One of them is polymerase chain reaction, and this is a molecular test that looks for the C. diff toxic B gene, and it's very accurate. GDH-EIA, this is a glutamate dehydrogenase, or GDH test, that goes along with an enzyme immunoassay, or EIA test. GDH is sensitive and can easily detect the presence of C. diff in stool samples, and this is an accurate test as well. EIA, this enzyme immunoassay test, is fast, but not as accurate as the other tests to find C. diff in stools, and is typically not used because of its rate of false tests. And then a cell cytotoxicity assay. This test looks for the effects of C. diff toxin on human cells grown in a culture. This test is accurate, but it is more difficult to do, and it requires 24 to 48 hours for results, so it's commonly used in research settings. And in the corner here, you can see what C. diff does to the cells in a colon, and so this is kind of what they'll be looking at when it's a stool lab test. And more ways to diagnose this disease is a colon examination, and then this is when your doctor uses a flexible sigmoidoscopy, I don't know how to say that, or it's a colonoscopy. It's a small camera through a tube to look for inflammation, and it's used to confirm a case of C. diff or look for other causes for your symptoms. And pictures from colon examinations are very gross, and you can really tell that it's infected. And I have a picture later, but beware if you're sensitive to that. And it's used to confirm a case. Maybe a lab test positive, and they want to make sure. So maybe your doctor would do a colon examination. And then an imaging test is an abdominal X-ray or CT scan, which provides images of your colon, and it looks for signs of C. diff, such as thickening of the colon wall, expansion of the bowel, or a hole or perforation in the side of your colon. This might be what that's an X-ray, but kind of an example. The microbiology and background, and then in their article, I don't know how to say their names. They state that C. diff is a gram-positive anaerobic spore-forming and toxin-producing bacillus belonging to the cluster 11 in the Clostridium genus, and it produces toxins A and B. The largest cause of C. diff is the overuse of antibiotics, which kills the normal bacteria in the intestine, such as phylum Bacteroidetes and firmicutes. When antibiotics lower the number of normal bacteria in the intestines, it gives C. diff a chance to grow and colonize in place of them, and then it spreads throughout the intestines when C. diff is introduced into the body. And because C. diff has spores, it can survive the acidity of the stomach and reach the large intestines, where it spreads and causes damage. So treatment, prognosis of the disease. Oh, and I forgot to say gram-positive, so it's purple. And that's kind of like what it would look like. So treatment, prognosis of the disease. It can be treated by stopping the antibiotics the patient was taking, and it's resolved 2 to 3 days after stopping antibiotics. And the infection can be treated with a different round of antibiotics, such as oral vancomycin or fidaxomicin. And then the CDC does not recommend further testing after the symptoms have gone away because it could cause the patient to get a new infection, or it could spread it. And then treatment could also include rehydration and electrolyte correction because of the loss of all the fluids and electrolytes because of the diarrhea. And then emergency surgery may be used for patients who have severe cases or perforations in their colon, and there's a 20% chance of getting an infection again. And as you can see in this picture, this is what a normal intestine looks like. And then once you take antibiotics, C. diff can colonize, have spores, and then develop, and really makes it nasty. And just that's why you have diarrhea, is because this is what your intestines looks like. And then antibiotics don't kill the spores, and so it could show up again. And then the mode of transmission and prevention, and is spread through feces or contaminated items that contain C. diff bacteria that gets into your mouth, usually by food or water, or just touching anything that has the bacteria and not washing your hands before you touch food or touch your mouth. And then prevention for C. diff includes adequate hand washing, especially when you're taking care of someone with C. diff, or if you have C. diff, taking a shower with soap and water and making sure to clean thoroughly. Soap and water are the main methods to stop the spread and prevent C. diff. Even if you do not get sick or have symptoms of C. diff, you could be carrying it, so you could spread the germs by not washing your hands after you go to the bathroom, and you can give it to someone else and not know it. So the site of infection is the colon and intestines. It colonizes and inflames the colon. It disrupts colonial epithelial cells by releasing toxins A and B. And so here is the lining of the colon. And as you can see, this is where C. diff colonizes the bacteria, and it's caused by the disruption of normal microbiota. Like antibiotics will kill the normal stuff, and then C. diff will come in and colonize, releases toxins, and then therefore kills the cells, has inflammation, and the body is just not able to fight it. And obviously, it kills all of these epithelial cells in your colon, which is not good. So this is the gross picture of the colon, of how the microbe causes disease. C. diff enters through oral contact from infected feces. It travels to the intestine where it colonizes and grows, especially if there's a lack of normal microbiota due to the use of antibiotics. And so C. diff is a gram-positive, spore-forming anaerobic bacillus, which produces toxin that can exist in a vegetative or spore state. So it does not need oxygen, and it has spores that can come back, which is very dangerous. And the spores are very resistant and can withstand high temperatures, ultraviolet light, and even non-chloride disinfectants such as hydrogen peroxide and detergents, which makes it able to withstand the acid of the stomach and return even after treatment. So it can come back very easily. And it colonizes in the intestine and releases toxins A and B, destroying the normal cells and microbiota. So it has a host, and that's the human intestine. It does not have a vector, but the reservoir for C. diff can be on surfaces, on hands, in food, water, and soil, and it can stay there for several months because it does have spores. So this is kind of how it spreads. You forgot to wash your hands after the bathroom, touch something else or someone else, and then that person has now ingested the C. diff. So the current update, it can be carried asymptomatically, meaning someone can have it and show no symptoms, and this is dangerous because it can spread through hospitals and nursing homes quickly, just because it has spores and can withstand some detergents. And it is really bad for people who are older or have weakened immune systems or are on antibiotics or like have cancer or any kind of immunosuppressant medicine. It could be detrimental to their health. And so, in their conclusion about C. diff, Perez states that overall incidence of Clostridium difficile infections and incidence of its more serious forms have increased due to the appearance of a hypervirulent strain, which has spread rapidly in recent years. And so that means it is very resistant to any kind of like defense mechanism from its host. So it's very resistant to that. And there's an increase in lifespan right now, and an increase of the aging population. So prevention of C. diff is really important for healthcare workers in particular and can save many people from contracting C. diff. So, medical staff, especially those who work with the elderly, should emphasize prevention techniques and prevent the spread of C. diff in their facilities. And that is it. And this is kind of like you can be carrying it but not have it. No signs or symptoms. Maybe this person is not on antibiotics, but once they take antibiotics, then they'll start to have symptoms, and so you might not know you have it. Here's my works cited, and then the reason I did this C. diff was because I asked my sister who just graduated from nursing school, and I said, "What do you remember about microbiology?" And she says, she said that C. diff was very prevalent and that she needs to know like the microbiology behind that, and so that's why I did this project on C. diff because I'm going to be a nurse. So that's it. Thank you for watching.